All right. So as I mentioned before, the main thing that's different for the 220, 230 test is they're going to ask you to do some heparin infusion questions and then the heparin protocol. So if you looked at any of these reviews or if you looked at your own review packet, you saw this monstrosity of a heparin protocol. And so I'm going to go over that, explain how to kind of navigate it, and then also show you like kind of the shortened versions that hopefully the next time they ask me to kind of create some input for some of these questions, I can say, hey, let's use some of these questions because they're less overwhelming. All right, so let me navigate down my review. And before I answer any of the heparin protocol questions, I wanted to first talk about, I think I have it here. Here we go. So this question here, number 20, is going to be a really good question to kind of set the stage for what you're going to be doing in the at least in the infusion rate portion of heparin. So what it's asking you to do here is it's asking you to convert units per hour to milliliters per hour. Okay. And then it's asking you to use your IV information in order to figure that out. So what I'm going to do first is I'm just going to highlight the important kind of data that's in here. You have 500 milliliters, 20,000 units. So that's like what's in your IV that you're available. And then you have an infusion rate set at 8,000 units per hour. And then the question is calculate the flow rate, but they want to know milliliters per hour. So you've gone from milliliters per hour to drops per minute. Um, this is no different. But it's just asking you to do a different kind of conversion. And so I gave plenty of practice with these. I'm just going to go over this one because I want to spend more time on the heparin protocol. Um, and um, and this is basically repeated multiple times in the heparin protocol. So what I'm going to do is I personally, like when I start these types of questions, I always like to start with the flow rate that they've given me, which is that 8,000 units per hour. So I'm just going to write 8,000 units per hour. And what I want to do is I want to convert this to eventually get to milliliters per hour. What I'm trying to do. Okay. So what I want to do then is I want to know, can I convert units per hour, or even just looking at units, can I convert units to milliliters? Well, I can. And the way I can is, what do I have available? I have heparin, 25,000 units in a 500 milliliter IV solution. So before I write any numbers or anything like that, I'm just going to write units, milliliters. I'm going to cross out units, and I'm going to be left with milliliters per hour, which is what I'm looking for. So before I do any math, I know that I at least have a strategy that should get me to the answer that I'm looking for. So I'm going to look at my available, and I see that I have this 0.45% normal saline. It says 500 milliliters. So I'm going to put the 500 with the milliliters. And then it says 20,000 units. I'm going to put the 20,000 units. Make sure I have enough zeros. And then what I'm going to do is I'm going to now multiply, then divide. So I'm going to take 8,000 times 500. I'm going to get 4 million. And then I'm going to divide by 20,000. And I'm going to get a final answer of 200 milliliters per hour. So, like I said, all we're doing here is we're just doing a conversion. We're converting units per hour to milliliters per hour. Okay. You're going to do the same strategy in the sub question below, but in this packet, at least the one that I kind of fine-tuned over the last couple of semesters, I won't even say fine-tuned, but I've worked through the last couple of semesters, is I just kept adding more sample questions to this. I wanted to give you lots of opportunities to kind of try these things out. So even though I'm not going to go through all of them, at least not all today, maybe today and on Thursday, but there's plenty of practice here for you. And then if you want to confirm an answer, just email me and I'll make sure you have the right answer, or remind me when we are, if you are meeting with me again on Thursday. All right. All right. So let's go to my heparin. So one of the things you're going to see is this, like I said, this monstrosity of a question. And when you first see this, the first thing that's running through your head is like, what do I need to do to answer this question? There's all these different blanks, and the one that I seen did not have all these things crossed out. The reason I cross these things out is just to show you like what's important and what's not important. So the things that I've highlighted are important for what is called the standard weight-based heparin protocol. What is the standard weight-based heparin protocol? If you do a Google search for standard weight-based heparin protocol, you're going to see all of this, steps 1 through 15, and it just lays it out. So multiple books, multiple resources online show that this was the protocol. And then I made the mistake when I made this test question a couple of years ago of putting the entire protocol on there. And I'll show you what I should have done instead. But now you're seeing it, at least you know, and then we'll hopefully be able to fine tune it some point in time. They haven't asked me to do that again, so maybe I messed things up by providing this and making them print off more paper. I don't know, but I'll show you the different ways that this will be asked and what you'll see like on ATI and things like that. All right. So basically what the weight-based heparin protocol is you know that heparin is an anticoagulant. It's to prevent clotting, and it's usually given to someone who's going to be bedridden, especially an elderly person after like hip surgery or something like that. And you have a couple factors. Obviously, you don't want them to clot prematurely because then that clot could travel somewhere to like their heart or their lungs or their kidney, and they could die. You also don't want to give them too much heparin, and then it causes them to hemorrhage and bleed out, and then they can die. And so you want to make sure you are staying within the guidelines, and the patient's weight helps to kind of assist with that process. And then there's reassessments, as you're going to see here later on as I kind of tackle this. Okay. So a couple things just to kind of get to the nitty gritty. What it's going to ask you is to answer a few questions, and the questions are actually below the protocol. The questions that we're asking are actually down here, and I'm just going to highlight everything. I'm just going to highlight it all in blue. Okay, these are the questions. So I gave you 4 questions. You're really only going to see 2 of these questions. Okay, this question will have 2 questions to it. You need to answer both questions correctly in order to get the whole question correct. So if you miss one or both, you just missed one question, okay? But after going through this, I feel pretty confident that you'll be fine and you won't have to worry about that, okay? So that's what it's asking. It's asking you to answer these questions. So getting back to the protocol, it's going to tell you the patient's weight. So you do need to know the patient's weight, and you need to know how to convert pounds to kilograms. Step 1, you need to be able to convert the patient's weight from pounds to kilograms. You already know how to do that. Step 2, the available, at least for the standard weight-based heparin protocol, your availables are fairly consistent. Your available, you have a 25,000 units, 250 milliliter half normal saline. That arrangement of heparin and an IV solution should look familiar. It's very similar to the first question that I worked through with you guys. And then it's also going to tell us a bolus dosage strength of 1,000 units per milliliter. So essentially what's happening in this protocol is the patient is going to be, laying in their hospital bed. You're going to start them off with this heparin protocol by giving them a bolus dose. Then you're going to start an IV drip. And then you're going to reassess after so many hours. And I'll explain that in just a second. Okay. So that's kind of what you're looking for, is just what are you doing? And then the questions are going to ask how many milliliters for the bolus, how many milliliters per hour for the infusion rate. And we're going to go through all that process. These other things, like these steps 3 through 9, really don't are not something you need to worry about. You might want to pay attention because you'll see things like after 6 hours, they, like checked the APTT, and what do you do next? Then I'll show you how to answer questions like that. But basically, everything else, you don't need to worry about filling in these things. That's not part of the question. Remember, this is a math test. You're just answering the math stuff. Okay. The next thing to pay attention to, and you'll see this repeated throughout the questions, is what is your bolus that you're starting with? So it says start with 80 units per kilogram. And then what is the infusion rate starting with? We're starting at 18 units per kilogram per hour. Okay. So they give you a lot of information. You need to know how to assimilate all that information and then put it together. And once you do it a couple of times, it'll become a habit and you'll be fine. But it's a little bit hard in the beginning. And so the best thing you can do is after I show you to do some of these, then to practice them. Okay. So let's start off with what this is. So notice here, it repeats the 80 units per kilogram body weight, 18 units per kilogram per hour. So it's just a repeat. You'll see that in the question. It'll repeat a lot of the protocol stuff. So the first thing I want to do is I want to take the patient's weight in pounds, and I want to go ahead and convert that to kilograms. Okay. So I'm not going to write anything out. I'm just going to take 156 divided by 2.2, and I'm going to get 70.9. Okay. You really shouldn't round that to 71, although it probably won't change your answer too much, but it should just be, I would just round it to nearest tenth because that's what you've been taught to do. But honestly, your final answers are probably going to be about the same, but we can double check that. So I'm going to use 70.9 kilograms as my body weight for this patient. So a couple things. The first thing it asks me to do is to calculate the number of milliliters to administer for the bolus. What is my bolus? What does my bolus state? My bolus states I need to take 80 units per kilogram, and my patient weight is 70.9. Now I'm going through this, and I'm going through this kind of slowly because I want to make sure you understand what to expect on this, because a lot of you, this is your first time kind of going through these, unless you've watched some of my previous reviews or you're really good at doing some of this stuff. This is fairly new. And so I just want to make sure you understand where I'm getting the information. And then as it kind of flows, you'll be able to see that a little bit cleaner as you kind of practice these a little bit more. So hopefully you know where we're getting the 80 units per kilogram. That's my order, okay? My order is 80 units per kilogram, and then the only other thing that I need in order to kind of complete the order is the patient's weight. And the patient's weight is 70.9. So what I'm going to do is I'm going to take the patient's weight, and then I'm going to put it down here. So this lets me do this. Oh, good. Okay, I'm just going to rewrite it. All right. So I'm going to take the patient's weight, which is 70.9 kilograms, and I'm going to multiply by my bolus, which is 80 units per kilogram. Okay. Now, I like to chop this up just to kind of show you the different steps. If you like to just write everything out as one long dimensional analysis, go ahead and do it. I'm not going to do that. I'm just going to write it out piecewise like this, just because I like to show you where the things are and where they're coming from. But if you feel comfortable doing it all one long dimensional analysis and you're getting the right answer at the end, perfect. You're doing it right. Okay. This is more so just to kind of help people who need like a pause to know like what to do. Because in a moment, I'm going to tell you like a shorthand way to kind of check your answers, and what I do anytime someone gives me or asks me like, oh, how would I do this if this was the patient's weight? And I say, and then I have a formula that I just kind of plug in and I get it done. But you're not going to understand that formula until I show you where those numbers are coming from. So I'm going to take 70.9 times 80, and I'm going to get a number of 5,672 units. Now, if the question had stated, how many units would you administer? We'd be done, but it doesn't. It says, how many milliliters will we administer for the bolus? So I need to convert units to milliliters. So my question is, do I have a way to convert units to milliliters? So I'm going to look at my available. My available is 25,000 units and 250 milliliters half normal saline. That's one of my availables. And then I also have a bolus dosage strength of 1,000 units per milliliter. Okay. We're calculating the bolus. We're going to use the bolus dose. Okay. In my mind, and I'm somewhat confident that this is how this is, but the bolus dose is like a separate vial that you're going to draw from with a needle, with a syringe, and then push it into the port on the IV, and that's how you administer the bolus dose. And then you're going to start the heparin IV drip. If you've ever worked with that scenario, you probably could confirm that, or it could just be way off and just be kind of like be in my MASH / original ER like kind of bubble and not really understand how all that is working together. But I think this is how it works. So what is my bolus dose? It says 1,000 units per milliliter. So I'm just going to plug in 1,000, my milliliter. I'm going to take my units that I solved previously, divide by 1,000, and I'm going to get an answer of 5.672 milliliters. And we're going to round that to the nearest tenth to 5.7 milliliters. So if I'm doing this as a shorthand, I'm going to take the patient's weight in pounds. So like, let's say you give me another number. That's really all that's really going to change on this is the patient's weight in pounds. And then I'm going to divide by 2.2, multiply by 80, divide by 1,000. And every time I do that, I'm going to get the answer. I just have to round. I have to round the answer at the end. Okay. So if you ask me a question like, oh, what's the patient's weight? Or if I did 125 pounds, like what would my answers be? I'm going to do 125 divided by 2.2 times 80 divided by 1,000. And there's my answer. Okay. Now, again, the only reason I know that is because I've been doing this particular problem now for many years. And so it just kind of flows naturally for me. I know you're not there yet. But you will get there once you practice. Okay. The more important thing is, can you look at the protocol and figure out where they're getting all this information? 80 units per kilogram. I think you see where that is. The bolus dosage strength and then the patient's weight. Okay. When we do the infusion, right? We have 18 units per kilogram per hour. Then we have our IV, right? This is what we're programming. And I think you're going to start to see the process. So when you get this question, what you're going to see is you're going to see what I have written here. You're going to see answer the following questions. You're going to see A, and then you're going to see B. You're most likely not going to see C on this particular question. You're definitely not going to see C in addition to A and B. What they want to know is, can you calculate a bolus and can you calculate an infusion rate? That's what they're testing you on. And after, like I said, after we do this, you'll be able to. All right. So let's do the infusion rate. My patient is the same patient, so 70.9 kilograms times. Now, what I'm going to be now multiplying by is the infusion rate. So my infusion rate, as it says here, it says to start a drip at 18 units per kilogram per hour. So that's what I'm going to multiply my patient's weight by. So I have 18 units kilogram hour. So we get rid of kilograms. And after I multiply by 18, I'll be in units per hour. So I'm going to take 70.9 times 18, and I'm going to get 1,276.2 units per hour. I'm just going to write that down. So 1,276.2 units per hour. Now, just like we did in the question before I started this heparin protocol, the question is, we're converting units per hour to milliliters per hour. So you've already done this, right? You did this in the previous question. How do we do it? We looked at our IV solution. We converted units to milliliters. The next trick is, which units and milliliters do we use? So going back to the protocol, what's my available? 25,000 units and 250 milliliters, half normal saline, and a bolus dose of 1,000 units per milliliter. If I'm calculating bolus dose, I use the bolus dose strength. If I'm calculating the infusion rate, I'm going to use what is in my IV bag, okay? Not, the bolus dose is not the IV. The heparin, 25,000 units and 250 milliliter half normal saline is your IV, okay? So those are the two numbers you're going to use. 25,000 units, 250 ml. So coming back to this, I'm going to plug those numbers in, cross out units before I do anything else. So 25,000 units, 250 ml. I'm going to multiply my 1276.2 times 250 divided by 25,000. And I'm going to get an answer of 12.762 milliliters per hour. And we're going to round that to the nearest tenth, which is going to be 12.8 ml per hour. So like I said, you're going to get two questions to answer for the heparin protocol. Calculate the bolus, calculate the infusion rate. Okay. Now, the reason I threw in the next blue question is just for extra practice. So I'm just going to scroll down to that real quick just so you can see. So what this says is after 6 hours, the patient has an APTT of 43 seconds. Then it says to calculate another bolus and another infusion rate based off of that information. So let's take a look at what the protocol says we do with that information. So I didn't go over steps 11 through 15 because that's basically what happens after the initial process of the protocol. And then you'll see that these steps 11 through 15 have different variations. So it'll say if the APTT is less than 35 seconds, if it's in the 36 to 44 range, 45 to 75 range, 76 to 90 range, or greater than 90. Those numbers will tell us what to do next. And so just kind of sticking with the thing or the question, it said that we have an APTT of 43 seconds. So what I'm going to do is I'm going to look at step 12 of the protocol. And again, I know that when you're going through this the first time, you're just trying to figure out where things are. This works a lot better also when you have this like laying in front of you and you can kind of just quickly navigate to these different things. Sometimes it's helpful to work on this on a separate sheet of paper. That way you can have access and see that. And then, like I said, I'll show you how I condense the information so it's a little bit more manageable. But just so you know, like what this is. So it says we had 43 seconds after 6 hours. So what do? It tells us to do a couple things. It says to rebolus with now 40 units per kilogram. So remember, the original bolus was what? 80 units per kilogram. So now it's telling us to rebolus, but this time with 40 units per kilogram instead of 80 units. Okay. The next thing it tells us to do is to increase the infusion rate by 2 units per kilogram per hour. So our original was 18 units per kilogram per hour. If we're going to increase it by 2 units, that means our new calculation is going to be based off of 20 units per kilogram per hour. So don't read that as, oh, that's 2 milliliters per hour. That is not what that says. That says 2 units per kilogram per hour. So you have to go back to the original infusion rate, 18, add 2, and you get 20. And if you look at what do we do here, like if we were going through protocol, like if the APTT was less than 35, then you're going to do a 4 units per kilogram per hour. So you'd go from 18 to 22, or whatever the previous infusion rate was based off of. All right. So we have the new information. Let me just write it down so that way it's here and we don't have to keep popping up there. So it told us to do a new bolus of 40 units per kilogram, and then a new infusion rate by increasing by 2. So, and I'm hoping that you're following along with this, but if my original was 18, my new is going to be 20. Okay. Now, we're talking about the same patient, so their weight really hasn't changed too much. So 70.9 kilograms, 70.9 kilograms. And what we're going to do is just cross out kilograms and then find out what our units are for the bolus and units per hour are for the infusion rate. Now, if I'm you, and because I know a little bit more about how these questions are asked on your test, I would say focus on just the initial infusion rate and the initial bolus for your practice purposes. Okay. You can do these for extra practice. It's just more of like kind of just making sure you can read through the protocol. But I don't know that I've ever seen anyone ask about the second set. I don't want to say that and be wrong, but if memory serves me correctly, I don't think they're going to ask you about the after 43 seconds, like what's it going to be. I don't think you're going to have to worry about that. But we're doing this as practice just in case. All right. So 70.9 times 40 gives me 2836. And that's units. We don't want units, we want milliliters. And guess what? We're going to use the same available that we did before because it's the only available that's been stated. Our bolus available is 1,000 units per milliliter. Which gives me an answer of 2.836 milliliters, which we're going to round to 2.8 milliliters. And 2.8 should be half of our original, which was, well, approximately half, 5.7, 5.6, but 2.8 milliliters. I'm going to do the same thing for my infusion rate. 70.9 times 20. Oh, I think I did something wrong here. 70.9 times 20. Oh, there we go. And I'm going to get 1,418 units per hour. I'm going to convert units per hour to milliliters per hour. So you'll notice that I'm doing the same conversion, but my available is the thing that's different. So what's different? Instead of the bolus dose, 1,000 units per milliliter, it's the IV of the 25,000 units per 250 ml. And then what I'm going to get here is 14.18 milliliters per hour. And we're going to round that to 14.2 milliliters per hour. So how can you practice this? The first thing you can do is realize that the bolus dose and the infusion rate, the starting point, the 80 units and the 18 units per hour, those are both consistent. So the only thing that really changes is what is the patient's weight. So one thing you can do is use your weight, use a friend's weight, parent's weight, um, use your significant other's weight, and then calculate the bolus and the infusion rate based off of their weight. Okay. And then you can practice any variety of that. And then if you want to do the second part is just you can decide what APTT you want to use and then just follow the protocol. But like I said, I don't think you're going to need to worry about that too much. I feel like you're just going to get these first two questions here. And then the shorthand is if I'm calculating a bolus and you just want to quickly get an answer, the shorthand to this is you're going to take the patient's weight in kilograms. Okay. So I'm just going to say kilogram weight. Then you're going to multiply by 80 and then divide by 1,000. And that'll give you your bolus in milliliters. Okay. So that's it. So you have to be in kilograms in order for that to work. For this one, you're in kilograms times 18, and then it's going to be divided by 100 to give you your ml per hour. I'm showing you this just because this is just like a real straightforward shorthand for your initial infusion rates or weight-based protocols. And sometimes it's helpful just to kind of see like that's all that you're doing. Multiplying by 18 divided by 100, multiplying by 80 divided by 1,000. The 100 comes from 250 over 25,000. That's the same thing as 1 over 100. Okay, so if you're one of the main reasons that I know that is just because I've been doing this for many years and I haven't memorized. So that's what it is. So like if you ask me, hey, I did my dad, he weighs 216 pounds. Can you just check that I did the bolus and the infusion rate correct? All I'm going to do is I'm going to take his weight, divide by 2.2 times 80, divide by 1,000. Make sure that that's the same ml that I got that you got. Usually the thing that gets wrong is you're rounding. So just make sure you're rounding to the nearest tenth. And then I'll do the same thing for the infusion rate. All right. Now, I wrote some of these in a condensed version, and this is what I hope we're moving towards. And you can see that I just kind of condensed everything. And this is what I think you're going to see. You might see that whole monstrosity of an infusion rate, but I think they're just going to ask you these two pieces of data. They're going to ask you to calculate the initial bolus and then to calculate the initial infusion rate and then move on to the next question. Okay. So you'll see here that the only thing that really changed is the patient's weight. So we went from the previous question said 156 pounds. Now this is saying 165 pounds. We're still going to do the same infusion or same bolus, 80. Start with the same infusion rate, 18 units per kilogram per hour. We have our same available, 25,250 ml. And then our bolus is 1,000 per ml. So all that stuff's the same. I just got rid of all the extra information that we really don't need in order to answer this question. Okay. And then I don't want to take full credit. This is another student at Boyce that did 220, 230. She had found some shortened, condensed heparin protocol questions, and so I just kind of borrowed some of those. So you can practice a few of these and kind of see how they go. I'll do a couple with you um, before I do, and you can see I just wrote up a bunch of different things. Okay, so there's a whole bunch of different variations of heparin protocol that you can work through, but I do think you're probably going to see the heparin protocol in its entirety, kind of where you have this whole thing here, and then the questions are below. Okay, so um, don't get too upset when you see that. Just realize that this whole thing is all that it is the protocol. So yeah, so someone asked, will the units per kilogram, units per kilogram hour always stay the same? Yeah, if it's following the weight-based protocol, it will be the same. Now, I have seen variations of that of the of heparin questions where they tell you to do 60 units per kilogram for the bolus, and then 16 units per kilogram per hour for the infusion. So they could change it, but you're going to read and pay attention and make sure that if they did change it, you know that that's there. I don't think that they're going to do that. I think they're going to follow the standard weight-based protocol, which is, like I said, the 80 and the 18. You're welcome. All right. So before I do another heparin protocol, are there any questions you have from the 230 packet? Okay, good. Go ahead.
Yes. So when I originally read the problem, and you see how number two it says that 25,000 units and 250 ml. I thought that half right there, is that just like half a normal saline? I thought that had something to do with the calculation as well. It doesn't
It does not. It's just
of
telling you that it's 50%.
of normal saline.
Yeah.
Okay. Alrighty.
That's a good question, and thank you for bringing that up because those are things that I take for granted that like, well, that's not important. No one thinks that important, and then unfortunately you're like, wait, do I need to worry about that? It's the same
Yeah.
thing like the 0.49% sodium chloride, the 0.09%, like all those different things. That just
Hmm.
tells you what type of fluid is in there, but
Yeah.
you don't care. I mean, it doesn't,
Okay.
I mean, you do care, but you don't care for math purposes.
Right. Thank you.
You're welcome. Good question. All right. Well, I'm going to go ahead and I'm going to work through the next heparin protocol question. And then if you have any questions um, beyond that, just let me know. And so I'm going to go ahead and work through this question here. So there's two parts that I created. Like I said, you're only going to see one or the other. You're not going to see both of these. It's just done there to kind of give you some extra practice. All right, so the first thing is I want to know the patient's weight in kilograms. So I'm going to take 165 and divide it by 2.2, and I get a nice even 75 kilograms. 75. All right, now all I'm going to do now is just follow the protocol. 75 kilograms. And I'm calculating bolus. So my initial bolus is 80 units per kilogram. And again, I'm not making that up. And if I forget, I'm just referencing what's written here. 75 times 80 gives me 6,000. So 6,000 units. And then I'm going to convert units to milliliters. And then my bolus dose is 1,000 units per milliliter because that's what it tells me. And so I'm going to get an answer 6 milliliters. So sometimes it's a nice even answer. That's what that's what I like. All right. Next, I'm going to do the infusion rate. So same patient, same weight, 75 kilograms. And I'm going to multiply by the 18 units. That's kilogram per hour. Apologize, I'm like not giving myself enough room here. And then again, how do I know that? Because it tells me start an infusion rate at 18 units per kilogram per hour. So I'm going to take 75 times 18, and I'm going to get 1,350, and that's units per hour. I don't want units per hour. I want, because it tells me I want milliliters per hour. So again, I'm going to convert units to milliliters, but I'm not calculating bolus, so I don't want to use bolus. I want to use the 25,000 and the 250 ml. So 250 ml, 25,000, and I'm going to get 13.5 ml per hour. So this one I don't even have to do any rounding, which is nice. But it's a good to practice some rounding because you never know what the patient's weight's going to be. Also, if you end up working in like cardiology and or I'm assuming that's who would be doing this, or hematology, or whomever's like kind of whatever grouping that you might be working with this type of thing, they might have some like standards, and then like you might not have to do exactly 165 pounds, or you might like have like a range where it's like, okay, yeah, we're just going to calculate that based off of 80 kilograms or 70 kilograms. But when you're in the CCAC dosage calc bubble, you follow the rules as far as we know them. Now, the other part of that question, and like I said, this is just more practice. You're not going to see a question. They're not going to give you two heparin questions. They're just going to give you this one bolus heparin protocol question. But just so you can kind of see, um, what happens after 6 hours. We have an APT of 40 seconds, and then it tells us if it fits in this range, then we rebolus with 40 and increase the rate by 2. So I'm just going to highlight the new order, right? 40, and then to increase by 2. So what they're talking about is, and this is referencing the previous problem. So what was my initial? My initial was 18 units per kilogram per hour. So we're going to increase it by 2. So my new infusion is going to be 20 instead of 18. So hopefully that's making sense. Now, 40, is exactly half of 80. So if you're sitting there going like, is it 3 milliliters? It's 3 milliliters. It's okay. It's not intended to be any more difficult than that. It is 3 milliliters. Okay. So but I'll just work through it just so you can kind of see. I'm going to take 75 kilograms times 40 units per kilogram. And that's going to give me 3,000 units. And then I'm going to convert units to milliliters. So 1 milliliter, 1,000 units. And then I'm going to get 3 milliliters. So like I said, a lot of times when you run through this a couple of times, and that's one of the reasons why I give you so many sample questions on this, is that it just become like you get into the flow of answering it. And if you're doing it a different way than I am, you don't like the way that I'm doing it, but you're getting the right answers, then keep doing that. I'm not here to tell you to do it. There's not one right way, okay? There's multiple ways. But make sure your way is consistent. Then lastly, 75 kilograms times, remember, originally it was 18. We're increasing by 2. So now we're at 20 units per kilogram per hour. So hopefully that's not tripping anybody up where that's coming from. That can be an issue, but so far it seems to be okay. All right, so now I'm going to take 75 times 20. I'm going to get 1,500. It's 1,500 units per hour. and then I'm going to multiply or get rid of units, convert that to milliliters, and then I'm going to use the 250 ml, 25,000 units. And I'm going to get 15 milliliters per hour. One of the things you want to be very careful with is you don't want to just, because you increase the infusion rate by 2, you don't want to automatically think, okay, 13.5 milliliters per hour, so 15.5 milliliters per hour. You'll see that you're close, but the specific answer is 15, not 15.5. So you don't want to do that. So anyways, there's plenty of practice here for you to work through. I will be connecting with your class again on Thursday from 1 to 1:50. Sometimes I get asked, will this be the same? Not necessarily, because it depends on who's here and what questions get asked. And also, some of you haven't started practicing yet, so you might have more questions. But if you have any questions between now and Thursday, or now and when you take your test next week, just email me, and I'm happy to answer any questions. But in the meantime, this will be posted up on onto YouTube later today or tomorrow, and then you can review it. Please let anyone that asks to know about it. They're welcome. This is a free resource for all of you. Um, and but yeah, I'm going to go ahead and wrap up there, and we'll reconnect on Thursday if you're here. If I don't hear from you, good luck on your test. I hope you do great, and I'll talk to you later. You're welcome.
We'll be meeting on the same link, Zoom link, right?
Correct. Yeah, same Zoom link. So that won't